I'm not really sure what episode of Ed Talks this is anymore, but that's okay. We're just going to move forward. So today we're going to talk about a very controversial topic. We're going to talk about fibromyalgia. Um, but we're going to talk about a particular aspect of fibromyalgia, and that is complementary therapies for fibromyalgia. So here's the thing, like there are a lot of people who are using alternative strategies for fibromyalgia, and by alternative I mean not conventionally used by the allopathic medical community, an MD or DO. So examples are acupuncture, massage, chiropractic, herbs, things like that. So those would be complementary therapies for fibromyalgia. Now the key here to figure out is which one of those therapies actually is helpful for fibromyalgia. The problem and the reason why it's so difficult to figure out which alternative therapy is good for fibromyalgia is that basically most alternative therapies actually do help the patient to feel better initially right afterwards, regardless of what therapy is trialed. And part of it may be due to patient expectations. Patients want to be better. So no matter what therapy they go through, at least when they immediately walk out of it, in general, patients tend to say that it was helpful. But what we need to know is long term. Long term, which of these therapies are actually impacting the patient's lives dramatically to the point where maybe they're on less medications or they're able to become more active. And it turns out that the data in complementary medicine is all over the place, just the way it is in allopathic medical world. So it's not a clear win for the complementary medicine folks. I think I might have smiled a little bit on that one. Anyways, whatever. Everything at the end of the day has some value. We just need to figure out how much value it has. And I think the biggest thing that came out of the study, honestly, was that therapies that require patient participation tend to do better for patients' fibromyalgia than therapies where the patient remains passive and just accepts things onto their body. For example, massage therapy. You're not very active in that. You're just kind of letting someone kind of do therapy onto you. And in fibromyalgia, part of the issue is that muscles and nerves are trying to remain inactive. And that may explain why therapies that require active patient participation seem to have better outcomes than therapies that don't. Interestingly, apparently, according to the study, it says that Qigong has a negative impact on fibromyalgia. And I think that's important, whether it turns out to be true or not. I think it's important for people to know that therapies, even if they're complementary or natural, can have a negative impact. Um, Everything has pluses and minuses, and ultimately you have to choose the ones that are right for you. I think that's it, especially because I'm past my usual 3-minute mark. All right, that's it. Bye bye.